This week, coronavirus cases around the world hit 2 million, raising serious concerns about the vast spread of the virus. While around 487,000 people have already recovered from the disease, sadly 130,000 cases have proved fatal. The virus has very different effects on different people, with some only experiencing mild symptoms, and others requiring medical help in the intensive care unit. Now, it seems that 5 key factors may affect your risk of suffering extreme symptoms, or even dying from COVID-19. The Centers for Disease Control and Prevention explained, COVID-19 is new disease and there is limited information regarding risk factors for severe disease. Based on currently available information and clinical expertise, older adults and people of any age who have serious underlying medical conditions might be at higher risk for severe illness from COVID-19. Here's round up of the 5 key factors that people who die of COVID-19 have in common. 1. Age studies have shown that people over the age of 70 are at higher risk of dying from COVID-19. In one such study, researchers in Wuhan, the city where the coronavirus outbreak began, analyzed 191 coronavirus patients in 2 hospitals. The analysis indicated that there's relationship between age and the risk of dying, regardless of any pre-existing conditions. Zibo Liu, co-author of the study, said, "Poorer outcomes in older people may be due, in part, to the age-related weakening of the immune system and increased inflammation that could promote viral replication and more prolonged responses to inflammation, causing lasting damage to the heart, brain and other organs." 2. Gender. Last week, new data revealed that men are more likely than women to die of coronavirus, although the reason for this remains unclear. In Italy, men account for 53% of cases but 68% of deaths, and in Greece, the number of cases linked to the male population is 55%, while they equate to 72% of deaths. While the reason for this remains unclear, some scientists suggest that the death rate could be attributed to men taking the pandemic less seriously than women. Speaking to HuffPost Canada, Diana Sarasi, Director of Policy and Campaigns for Oxfam Canada, said, "Women are very worried about what they're seeing in terms of far-reaching and long-term impacts of this pandemic. What's happening right now is very typical for any sort of crisis, in terms of women mobilizing to be first responders, taking on the care work." 3. Underlying conditions. People with underlying health conditions are also at higher risk of dying from coronavirus. This includes people with chronic lung disease, moderate to severe asthma, heart conditions, diabetes, liver disease and kidney disease. Professor Fan Chung, an expert in respiratory medicine at Imperial College London, said, "It's new infection. But from our experience with dealing with flu epidemics, we know that people with various conditions will fare worse." A paper has just published in the New England Journal of Medicine that looked at the first 1,001 cases in Wuhan. The figures showed those with diabetes, high blood pressure, heart disease, COPD, cancer and renal disease, fared worse, and suspect the people who very unfortunately died in the UK had one or any of those conditions. 4. Obesity. People who are overweight are also at increased risk of dying from coronavirus. Last month, an NHS audit revealed that almost 2/3 of patients who fall seriously ill from coronavirus are obese. According to the audit, 63% of patients in intensive care in UK hospitals because of the killer virus are overweight, obese or morbidly obese. Meanwhile, Professor Jean-François Delfraissy, France's chief epidemiologist, has also warned that people who are overweight are at higher risk. He said, "This virus is terrible. It can hit young people, in particular obese young people. Those who are overweight really need to be careful. That is why we're worried about our friends in America, where the problem of obesity is well known and where they will probably have the most problems because of obesity." 5. Immunocompromised. Finally, people who are immunocompromised, indicating that their immune system isn't as strong and balanced as it should be, are also at increased risk of dying. Many conditions can cause person to be immunocompromised. This includes undergoing cancer treatment, smoking, undergoing bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune-weakening medications. Writing in The Conversation, Sarah Jones and Fabian Vincent, researchers from Monash University, explained, because immunocompromised people's immune systems are defective or ineffective, they're unable to stop invasion and colonization by foreign intruders, including the SARS-CoV-2 virus, which causes COVID-19. An under-performing immune response leaves people susceptible to infection, but the severe symptoms in some people are actually caused by huge immune response sweeping over the whole body.